Most drivers assume the urine test at their DOT physical is a drug test. It is not. And that one misunderstanding causes a lot of unnecessary stress before an appointment that is actually pretty straightforward. Here is what is actually happening when you hand over that sample. The urinalysis at your DOT physical is a health screening. The medical examiner is looking at biological markers in your urine, not checking for drugs or alcohol. That part of DOT compliance is handled separately by your employer or a third-party administrator under a completely different set of regulations. The physical exam urinalysis and the DOT drug test are two different things, governed by two different processes. Keep that distinction clear. So, what does the examiner actually check? They use a dipstick, a simple strip dipped into the sample, and it gives results in minutes, right there in the clinic. No lab send-out required. The markers they are looking at include glucose, which can signal diabetes or prediabetes, protein, which may point to kidney issues, blood in the urine, which can indicate kidney stones or an infection. They also look at specific gravity, basically how concentrated your urine is, along with pH levels and signs of a urinary tract infection. None of that is pass or fail in a simple sense. An abnormal result does not automatically take you off the road. What it does is give the examiner more information. They factor it into everything else they are seeing: your health history, your blood pressure, your overall physical. In some situations, they may ask follow-up questions or request additional documentation before making a certification decision. If you have a known condition like diabetes or kidney disease, bring records from your treating physician. That context matters. An examiner who understands your full picture is better positioned to make the right call. A few practical things before your appointment. Stay reasonably hydrated, but do not overdo it. Extremely diluted urine can throw off test accuracy, and try not to use the restroom right before you arrive. You will need to provide a sample on-site, so plan accordingly. Be straight with your examiner about what you are managing health-wise. Hiding a condition does not make it go away. It just means the examiner is working with incomplete information. Transparency makes the process smoother for everyone. If your results do require follow-up, the examiner will walk you through next steps. That might mean a conditional certificate, additional testing, or in some cases, a waiver or exemption through the FMCSA. It is not the end of the road. It is just more road. The one thing you can control going in is being prepared. Know what the test is actually checking for, and show up ready to have an honest conversation with your examiner.